Dr. Subhashandra, uh, how often do you have patients in your practice complaining of a chest pain or palpitations? And how often is it that serious that it needs immediate attention? Because the reason I'm asking you this is that a lot of people who get the chest pain sitting at home ignore it, saying that ये तो acidity है.
Very good question. Very
So,
good
yeah,
question.
good question.
If there is before he says anything, if there is one enemy of medicine in India, that is the concept of gas in India.
Yes, and hygiene.
It's an enemy, I tell you. You know, I know patients in India, I don't know how this has come into our culture. If they have any problem in the chest, any problem in the upper part of the tummy, some of the patient, even if they have some problem in the head, they say, sir, gas ki problem ho sakti hai. You know, I don't know how it has come into the our culture. So they have a gas in the brain rather than gas in the stomach. One doctor, himself doctor, he went to London. He had a chest pain. He took Pentocid. Pain subsided. Next day morning again he had a pain. This time it was a little more. He took 2-3 Pentocid. Still didn't go to the doctor. Third, he had pain again. Then he goes to emergency and he had an extensive interval myocardial infarction. And his ejection fraction dropped from the normal to 25%. This is the havoc and damage the concept of gas is doing in this country.
So a lot has been said, but to your question, as human beings, there are two extremes amongst us. There's a whole spectrum. So there are patients who would underplay their symptoms. A lot of them are there. As Dr. Kler rightly said, they would say it is gas or something else. There's another extreme who suffers from cardiac neurosis. They're very anxious, and any silly pain, they would say that this is cardiac pain. There's a misconception in public that the heart lies on the left side of chest. So any pain which comes from left side is a cardiac pain. And we all have come in practice now for many decades and have seen such patients. A simple reassurance would work with them. But as clinician, we got to delve deep into their symptoms, the coexisting factors. We at this stage are confused sometimes and not able to distinguish. And we err on a safer side, as Dr. Kler pointed out, that it's better for a clinician to err on a safer side so that we don't lose these patients. There have been patients who have been lost by our misjudgment, and we as clinicians presume that this doesn't look like cardiac. So to augment our thinking, there are a lot of other factors which are available, like the troponin test, which is an enzyme released during heart attack, or a simple echocardiography, which regional wall motion is very quickly picked up if somebody is undergoing heart attack in that process or in the tracks. Even ECG, serial ECGs are very important. So these 3-4 parameters, all of us regularly use them. And if we have slightest doubt, given the other factors in patient, like if they have a family history or they have diabetes, our threshold of dealing with them is much lower. We just jump on them and err on a safer side. There could be a chance that this turned out to be non-cardiac, or even a CT angiogram shows nothing. But the distinction between a cardiac neurosis and a genuine cardiac pain is very, very important. And it is there that we try to educate public also when it comes to dealing with pain, how to recognize the cardiac symptoms and when should you rush to the nearest hospital. And these devices which we discussed at great length are very, very useful tools in the current times. Dr. Sahani has it. I am surprised to see that he had it almost 10 years ago. Whereas I know about cardia just about in 2-3 years time. And it's a very, very valuable device in terms of picking up arrhythmias. The worst part of atrial fibrillation, which all of us struggle to pick up, by Apple Watch or something, is that the patients land up with a stroke. And atrial fibrillation is a very, very common problem. Almost 10% public suffers from it beyond the age of 60 years. And we invariably miss it. And the stroke would happen at the stage of transition, when his normal rhythm is going into atrial fibrillation or he's reverting back to normal. That is the time when he forms a clot in the heart, and that clot travels to the brain and he dies. So besides flecainide, which was given to control his rhythm, the most important aspect is to give them anticoagulation based on the risk of throwing embolus and landing up with a stroke. So that's a real challenge globally. And it is there that the Apple study and Apple Watch has been very, very important tool. And telemedicine has, let me tell you, Today, if the world's population is 8 billion or so, almost 6.8, that's 80% of population today possesses some kind of phone, smartphone or any other phone. And the whole concept of, exploiting AI or this telemedicine lies in this the very fact that the social apps are there with every human being. Why not use them to, improve their health? That's the whole idea.